Since we suspended international travels and tracing of contacts, the approach has moved towards controlling community transmission. And we are aware that this issue has generated a lot of debate. We want to make it clear today that contracting coronavirus is not a crime. All of us have a potential risk of contracting the disease. And that is why we have come up with measures and guidelines to ensure that we are all able to control transmission of this disease. Being quarantined is neither a detention nor a punishment. Quarantine is meant to serve the greater public good in ensuring that we protect our country. We therefore must urge you, fellow Kenyans, to join us in ensuring that we do not stigmatize those who are sent to quarantine facilities and even those who have recovered from this disease. As we have always stated, if we continue to work together as one people and one nation, we shall be able to overcome this pandemic. We are glad to note that the travel restrictions and curfew measures, which are part of containment measures, are yielding results. We would like to urge people to continue adhering to these measures. I would also like to appeal to our security personnel and those charged with law enforcement to ensure that we continue to exercise great caution and a high level of understanding when we are engaging with those who are in quarantine facilities. We must work together to ensure that no lives are lost as a result during of this pandemic. And this is our wish in terms of protecting our countrymen. We are glad that Kenyans are taking basic hygiene measures seriously. Towards this end, we are seeing very wonderful innovations with regards to hand washing facilities. And we do have one present here today. For instance, the step OSHA that we have here has actually been utilized by members of the Ministry of Health and forms one of the containment measures that we are advocating for different institutions to put in place. Today, we are celebrating our local innovators who have put all these different devices in place to ensure that our containment measures are actually useful in flattening this curve. We have, however, fellow Kenyans, noticed a worrying over-reliance on sanitizers. While sanitizers are effective, soap and running water is the best for fighting this disease. People must therefore start prioritizing washing hands and only sanitize in conditions where sanitizing would be useful. And this has been elaborated in our communication and in our guidelines. As we continue with this fight, we have also observed that some public service vehicles are defying our containment measures. And increasingly, we are sliding back to the old ways of conducting business. We would like to remind Kenyans that action shall be taken against anyone known to be flouting the current containment measures in place. Fellow Kenyans, it has come to our attention that we do require to continue providing education with regards to coronavirus, and today we would like to highlight the issues of symptoms. We have seen and had concerns from the public regarding how the pathogenesis of this disease evolves. In other words, regarding the issue of being asymptomatic. We've noted that there's confusion about it, and fellow Kenyans, we're here today to tell you that this is a new virus, and scientists across the world are still learning. However, one of the key things that we need to remember is that, one, the incubation period for COVID-19, which we would infer to be the time period between exposure of the virus to the time when the onsets come about, on average is usually 5 to 6 days. And sometimes in some individuals, according to the evidence that is coming in, this can actually go up to 14 days. And during this period, it is important to note that the people who have this virus within them can still transmit the virus to different people in the community. Secondly, studies have shown us that sometimes you may test positive for coronavirus depending on different time periods. Some people could test positive between 1 to 3 days of contracting the virus, and this is still an issue that is under surveillance in terms of scientists trying to study it to understand. Again, fellow Kenyans, what we are trying to emphasize is that this is a new disease and we are trying to understand it. And therefore, the measures that we are putting in place are all with the aim of trying to reduce the risk of transmission. So 2 things are underscored by the current knowledge that we have on coronavirus. That we have to be consistent in terms of ensuring that we are disciplined, and consistent in ensuring that as we try to put in place the different approaches in terms of testing, isolating, and tracing, that it is important that we all understand that as Kenyans, we do have that personal responsibility in controlling the spread of this disease. It is imperative that all our frontline workers, and this includes not only our healthcare workers, but also our truck drivers, our matatu drivers, our journalists like yourselves here today, bankers, security personnel, all personnel that we've termed as essential, ensure that they adhere to the containment measures. Because you are essential services, it means that you are actually the highest risk of cohorts who are able to spread the disease in our community. And therefore, we do beseech you, those who are termed as essential services, to ensure that you continue adhering to the containment measures, ensure you wash your hands with running water and soap, and ensure that you're wearing face masks at all times. Fellow Kenyans, today our coronavirus situation is as follows. In the last 24 hours, we have tested 668 samples. Today, we've been able to share with you a distribution as to the number of samples collected per county, and this will be availed to you. Nairobi still stands as the highest burden of disease county, and so far, we've run 478 samples in Nairobi County. From the samples collected today, we have 17 persons who have tested positive for coronavirus disease. This therefore brings the total of confirmed cases in the country to 320 cases. All the 7 are Kenyans, 12 from Mombasa, 5 from, all the 17 are Kenyans, 12 from Mombasa, 5 from Nairobi. 15 of these were picked by our surveillance teams, and it is important to emphasize the fact that they were picked by our surveillance teams means that these people were living within our communities. And fellow Kenyans, the evidence that is coming in from our testing shows us that indeed local transmission has been established, and therefore the measures that we keep on reiterating on need to be followed. 2 of these cases are from our mandatory quarantine centers. With regard to gender, 9 are males and 8 are females, and they are aged between 22 to 60 years of age. And on a positive note, we are glad to inform you that 6 patients have recovered and have been discharged, and therefore we now have 89 as the number of recoveries in the country. I thank you.